Why HIPAA sucks. Or, no, I shouldn't say that. Understanding why HIPAA makes your life better. It doesn't. It's really difficult and it's hard for all of us to understand how to deal with it. How to make HIPAA make sense more better. This isn't going well. Understanding HIPAA, a guide to security. Yeah, that's what we'll go with. I like that. Okay, so basically, HIPAA has all these different security rules, and there's also privacy rules and tons of stuff that are involved with HIPAA. But what we're focusing on is HIPAA security. That's our job. That's what we do. We want all of you to understand how to go about it. So, first comes first, encryption. So the federal government has the National Archives, and this website is actually the Code of Federal Regulations. And this is where you can kind of scroll through and lay out everything regarding HIPAA and try to understand it. So encryption, for example, is under 164.312 technical safeguards, and it's required or addressable or, whatever. But I'm basically going to help you make sense of it by talking about encryption. So encryption, see how there's a little key lock on the keyboard? That's how encryption works. Not really. Basically, encryption is a mathematical equation that messes up all the data so that if someone steals it, nobody can actually read what the data is. That's how we keep things secure. So to discuss it in more basic terms, it's like you take a message and you put it through a math equation that jumbles up the message, and there can be a key, like a decryption key, like the word safe, for example. And if someone has that message and it's all mumbled up, they need to know the algorithm and the key to decrypt that message, right? This is very basic. There's a lot more complexity to encryption. But that's basically what it is. It's just math. And if someone were to steal data, steal your hard drive, break a window, nab your computer, run off with it, open up, figure out how to unlock it, get in, or just steal a hard drive and try to read it, they wouldn't be able to actually read it. Here's why encryption is so important. It protects the data of the patients if that data is on your computer or housed on a computer with electronic medical records. So remember, PHI, protected health information. Okay, medical records, right? Seems simple enough, but it gets a little bit more complicated than that. The important thing with this portion of the HIPAA security rule is that encryption of PHI, medical health records, and devices that access PHI, which can act as storage. Here's what I mean. You're probably thinking, oh, I pay a cloud service to host all of our medical records, and this is what we use for our medical records. This is our EMR system. It's great that the computer or the server or whatever that hosts those medical records is encrypted. But you also have to be concerned about the computer that accesses those records and can also house those records in a spot that you don't usually think of, like your downloads folder. Look at that downloads folder. That has got a lot of information in it. So here's the thing. Our downloads folder, oftentimes when we access the electronic medical record system, we download the patient files to be able to look at the patient files, right? I've seen a lot of practitioners, I've seen a lot of doctors, nurses, nurse practitioners. I've seen a lot of them do that. What you don't realize is that it gets stored in the downloads folder of the computer that you're working on. Well, is that computer encrypted? Because now all of a sudden, you've got medical records on that computer, and that's kind of a big deal. So you've got to make sure that the computer server, whatever, that's housing your EMR is encrypted. And you also have to make sure the computers that you are using that access the EMR, whether it's through a web browser, Google Chrome, or even accessing an EMR system locally there on the same network, if you understand what that means, is also encrypted. So you got to cover all your bases. No way to get around it. Great thing though, There's a lot of ways to encrypt your computer. One of the easiest and most effective is the encryption service that is meant for the computer that you're using. Being that most offices, medical facilities, and practices use Windows computers, I'm going to talk about Windows. So here's the thing. Everybody should be on Windows 11. You're not supposed to be using outdated versions of operating systems or components. That's also a part of HIPAA, FYI. Windows 10 is end of life. You're not supposed to be using it anymore. Most people think, oh, I'm on Windows 11, and that's great. But what version of Windows 11 are you on? Are you on Home or are you on Pro? And that's important because Home and Pro come with different things of encryption. So, for example, Windows 11 Home can have device encryption, but it does not have drive encryption by BitLocker. And BitLocker is the key. So the best thing that you can do is make sure that you're on Windows 11 Pro and that BitLocker is enabled. I would encourage you to go check out the different versions of Windows 11 Home, Windows 11 Pro, or even, heck, there's Windows 11 Enterprise, and make sure that you have BitLocker encryption enabled. There are a lot of other tools out there that you can use to encrypt your hard drive, but in my experience, they really slow the computer down. They make performance issues. The nice thing with using an encryption service that is native to the environment that you're working on, like Windows, is that it means it will work and it will run smoothly. So I would encourage you to get BitLocker enabled and make sure that you're on Windows 11 Pro. You can go through the Microsoft Store, you can upgrade, makes it very easy, okay? You never know what medical files are going to be hiding in your computer on the downloads folder or even in a different folder that you're not really aware of. And if there's a breach and HIPAA comes and investigates and they find out that there's medical records on that computer and you didn't make sure it was encrypted, that is negligent and they will come after you. They will absolutely come after you. If a hard drive gets jacked out of your computer, that BitLocker encryption makes sure that hard drive can't be read by whoever copies it or tries to look at it, okay? I would not wait to do this. This is a big part of security for HIPAA. Do it now. Figure out how to turn on encryption. Figure out how to cover your bases.